There's like an old saying in the military, sergeants are the backbone of the Army, nurses are the backbone of the healthcare facility.
I was diagnosed on February 2011 with rhabdomyosarcoma. I had treatment for a year. I started with chemotherapy and then I went to radiation. I had radiation twice, both like in the middle of my treatment and at the end of my treatment to my leg and to my hip. And then I relapsed in August of 2012. It was just really hard going to treatment because like chemo is really tough. But then I met Melissa and then it helped me a lot. Yeah, today was my last radiation.
Valentina and I have a very special bond. She was the first patient that I ever told my story to. When I was 10, I was diagnosed with kidney cancer, Wilms tumor. My tumor had also burst my kidney, causing it to spread to other organs. It spread to my other kidney, my liver, my chest, and my lungs. And I almost passed. I was a kid that wasn't supposed to make it, and I did. This is a magic finger for the day.
I feel like Melissa's in this fight with me because she also lived it. I don't want to cry. When people say that, you know, be strong and things like that, I mean, I appreciate it, but it's not like they don't understand what I'm going through. That's why she helped me a lot because she was able to tell me that she lost her hair, she was also sick, she had surgeries, and she also understood what it felt like to go through chemo.
I think the older you are, the more it hits because you've gotten settled into school, you've got your life going, you have your friends, you play sports. Valentina is such a fighter and she has inspired me from day one. She's so positive. She went through the normal emotions that everyone goes through when they're initially diagnosed and then just became this positive light for everyone around her.
This one I had made for a friend because the butterfly represents a cancer patient who was my friend and she passed away. And those are the hands and they're letting her go. And I decided to give it to the clinic.
The hardest thing about being a nurse for me is watching kids die. But with that being said, just coming in and being able to make a child smile, I'm that crazy nurse that'll dance or sing or whatever I can do just to put a little bit of joy in a child's life when they're going through this because it really, really makes such a difference.
I was at work and I was talking to some of the other doctors and all of a sudden I just had a very weird sensation in my head that I had had before about a month earlier that I had actually forgotten about. And then I had a seizure and fell off the chair.
One morning they said there's a doctor coming in who had a bleed over at Imperial Point, I think it was, and they were like, he's going to go for angio. He had an aneurysm, and Dr. Irwin's going to do a coiling on it.
We're going to give Dr. Irwin a call, you know, which to me meant I knew that at that point I had a ruptured brain aneurysm, and that's all I remember for a week.
I didn't know if he was going to die, and I didn't know if he was going to be brain damaged, and I don't know that I had the strength to go there.
A very scary time for my wife because she had just given birth to twin boys. My boys were 7 weeks old when it happened, and my daughter was 2.5 when it happened.
It was more comforting her at that time.
I remember the first day James came in with his pressed scrubs. He was a military guy, so you don't often see people with iron scrubs. James in particular really had that soft human touch. And really, the nurses, I think, got me through the most impossible time.
And this was all this white is blood. It's all along this edge here.
He took his doctor hat off and was a patient and just let us do our job. And I feel nurses are the backbone of the healthcare facility because we're frontline. We're the support between the family and the patient.
Hey, James. How's it going, man? See you. Doing good, man.
I have a much greater appreciation now for the role that the nurses play as the eyes and ears and the ones in the trenches who are always there to implement the care in a planned and safe way.
The simulators are humanoid mannequins who in fact have the ability to manifest any malady that might exist in any human being.
These simulation mannequins really allow our nurses to have hands-on experience and simulate a critical situation. For example, perhaps a loved one coding or a critical procedure. So that way, when they're in the real life situation with these critical procedures that are so important to patient safety, they've already simulated the team communication and the time and the sequence that it takes to save a person in our community.
We're particularly excited about the virtual hospital because this will be the only hospital-based program of its kind in Southeast Florida. With upgrades and an expansion of the program can also be used to train our residents. These simulators take training to another level, and bringing them into a hospital makes them even more real. Ultimately, for the Valentinas and the Bryans and all the other patients who come to us for help.
The hospital and the medicine is the one that helps you and stuff, but the people, you know, the love and the support they offer helps you emotionally, and just thank you for being there for me.